Hello and welcome. My name is Sally Deckard, and I am a faculty support and classroom consultant and host for this session. Redesigning an Rn-bsn program with competency-based education, a roadmap for aligning with AACN 2021 essentials, with UAGC Associate Professor Dr. Debbie Beck, lead faculty in the Department of Health and Human Services. By joining us today, you acknowledge that this session is being recorded and will be shared with TLC-related materials. Microphones will be muted for this presentation, but we encourage you to post questions and comments in the chat. Also, we have enabled live transcription, and if you would like to use it, simply click the Show Captions button at the bottom of your Zoom window. And now I am pleased to introduce our presenter. Dr. Beck brings over 40 years of clinical, administrative, and academic experience to her work at UAGC. The depth and breadth of her experience uniquely qualify her for her work at UAGC and her presentation today. And so, Dr. Beck, I will get out of the way, and as they say, the floor is yours.
Thank you, Sally. Thank you, everyone, for joining, and welcome to our session. Today, we're going to talk about how stakeholder engagement and systems thinking can really drive competency-based education redesign, not just for our program, the Rn-to-BSN program, but also other programs throughout this university as well as others. We, as the Rn-to-BSN program, are tasked with aligning our program with the 2021 AACN essentials. And those essentials have particular competencies and sub-competencies that we are tasked with mapping, looking at gaps in our program, and then converting our program into a competency-based education model. And in order to do that, we need to look at broader systems throughout the university to drive that change. So in this presentation, we'll really be exploring competency-based education, how it works, who needs to be involved, how the systems thinking model is based in Sanjay from 2006, who can really help us incorporate the systems thinking to incorporate competency-based education and understand the relationships between how people, processes, policies, and technologies overlap and work to move this model forward. We'll conclude then with a full implementation plan and timeline to help you get a sense of how we've identified meeting these particular milestones and identifying key stakeholder roles in this process to support all the decision-making throughout this change and ultimately integrating the competency-based model. So I wanted to just start with some of our objectives. As I've outlined, we're going to take a look at the stakeholder roles in implementing competency-based model redesign and curriculum alignment. We're going to apply systems thinking to support our institutional change according to the Sanjay model. We're going to align our competency-based education outcomes with AACN 21 essentials. We're going to share a plan over a 3-year period that will implement this particular strategy and shared governance. And we're going to foster collaboration across systems, departments, and use a collaborative model to share this feedback. So I wanted to just take a moment here to share with you some of the feedback that you graciously provided in our poll results because I found them interesting. And I wanted to let you know that I am considering this feedback as I proceed with discussion in this presentation. So the first question in the poll was, how familiar are you with the AACN 2021 Essentials for the RN to BSN program? And as anticipated, I expected that not many, unless you're associated with the RN to BSN program, would you be familiar with these essentials in our program in much depth. So 0 of the 5 respondents had any familiarity with the essentials or the RN to BSN program and what that integration might look like. The second poll question that you answered was, what has your experience been with curriculum mapping and identifying gaps in relation to the curriculum or any program? And also, as anticipated, 2 out of the 5 respondents, approximately 40% of you, said that you have actively participated in curriculum mapping and gap analysis, which is great. Some of you, 40%, 2 out of 5, have some experience, but that experience is somewhat limited. And then lastly, only 1 of the participants identified that they have not been involved at all in curriculum mapping or gap analysis. Going on to the third question, it asked, how would you describe your experience with competency-based education and alignment of the curriculum? And of the responses, about 14%, 1 out of 7, said they had extensive experience aligning curriculum with competencies. 6 out of 7, or 86% of you, indicated that you had some experience with alignment efforts. And lastly, there was 1 respondent that had no experience with competency-based alignment. So there is some familiarity. The experience varies somewhat. And lastly, the last question in the poll was, how would you rate your experience implementing curriculum and competency-based education across university-based departments and systems? And the poll results here, 2 out of 6, or 33% of you, indicated you had significant experience implementing across multiple systems. 2 out of 6, or 33%, indicated you had some experience, and 2 out of 6, or 33%, indicated that you had no experience. So I considered this as I kind of adopted my presentation to consider the audience before me. So we'll then move on to what exactly is systems thinking. And systems thinking really is a view that organizations have of how to implement and organize a process or something they want to move forward as a change, but not looking at that in a system of silos, but instead interconnected systems. What are the relationships? So according to Sanjay, sustainable change only really occurs when the relationships between policies, behaviors, people, and structures are really understood. In education, this means that changes to our curriculum cannot be separated from faculty workload, technology platforms that need to be used, advising systems, and student support. So viewing our program or any of your programs as an ecosystem reveals leverage points for long-term success of this integration or any possible integration into a competency-based model. Competency-based education as a model is very well suited to systems thinking but it touches on everything in the curriculum, the assessments, the course delivery, student progression, and all of these coordinated and institutional-wide systems need to be incorporated in the planning process to avoid unnecessary fragmentation and approaches to implementation. So the Aacn essentials, most of you indicated that you really didn't have any knowledge or experience with this. The essentials are our standard framework, which guide how we develop our nursing programs across university systems, from bachelor's all the way up to doctoral programs. All of our programs are aligned in some way to the essentials. In 2021, AACN put together a new set of frameworks for all levels of nursing. And those frameworks are included with a series or a set of 10 domains. And those domains include public health, informatics, and equity. It provides complexity expectations at both the entry level, so a bachelor's level learner, all the way to advanced levels through doctoral education. It encourages outcome-focused interprofessional education, and it really shifts the emphasis from a time-based to demonstration of learning model. It demands alignment across curriculum, assessments, and university policies and frameworks to accomplish this. So taking a look at this and applying it, you can see that these new updated nursing competencies are a collection of core nursing complexities that represent how fast-paced healthcare is moving. And these complexities of modern healthcare are now reflected in these new updated 2021 essentials. It also includes evidence-based practice emphasis, where the curriculum promotes evidence-based practice, ensuring that nurses apply research and best practices in our current models and applications of patient care. It also includes informatics and quality domains so that the essentials are organized with key domains like informatics and quality improvements to meet the demands of ever-changing healthcare. So, as we go on, who are the stakeholders in this framework and model? So first of all, our faculty are involved in this process. So faculty are involved in the course design, rubric development, our teaching strategies, and a successful redesign includes them as a core key stakeholder in this process. Likewise, our students are stakeholders. They are the ones who will proceed through the curriculum as it's structured, and they need to be a part of the decision-making process, gaining their input about what their learning needs are. They need to give us some feedback on pacing. They need to give us information about our rubrics and how clear they are. And they need to give us feedback on any revisions or iterations of the course design or the rubric design assessments and the key indicators that are in those assessments to give us feedback on how this looks and feels from a student perspective. Likewise, leadership is part of this dynamic. They must provide strategies for backing up our key stakeholders, approving key policy changes that will need to be made, fund necessary resources like learning management system upgrades, and possibly even giving faculty who will be spending considerable amounts of time integrating a system like this some course release time. They will also be involved in advising staff, IT teams, and assessment specialists to also assist in garnering their support as key stakeholders and helping plan the day-to-day roles that each of them will play in the implementation and data tracking of these systems. So our curriculum committee and IT and advising teams all also need to be involved as key stakeholders in this process to make sure there's alignment. The curriculum committee needs to grant approvals. We need to have quality control systems in place. And we need to make sure that our IT can support our systems. We need to make sure that advising is aware of the processes and can give us feedback. And a key stakeholder in this process is also our assessment teams to make sure that our assessment teams can develop rubrics that are reflective of progress indicators in a competency-based progressive model. So how do we include faculty in this systemic redesign? So faculty are really at the heart of this redesign process. And we need to make sure that we have them in the discussions from the very beginning so that they have an understanding of the shift that occurs from lecturer to more of a coach using a performance-based assessment and individualized support for students, which would require substantial professional development on their part at the get-go of any implementation and discussion of a process such as this. Faculty really should be given training in backward curriculum course design, rubric use, and feedback strategies before we start a process. We need to make sure that faculty are engaged to ensure buy-in. We need to involve our faculty early, let them co-create with us as leaders and lead faculty and leaders of the organization to co-create, to provide input, map competencies, and make sure that our assignments and our assessments reflect real-world healthcare scenarios. This collaborative approach promotes ownership and ensures practicality. We need to also be cognizant of any faculty concerns that might be raised about the time that's going to take to engage in this process, the time that it might take for grading, and the extra time that might be taken in doing their feedback and giving evaluation. Competency-based education primarily initially adds complexity to this process until it's well understood and integrated. So we need to make sure that we're aware of the possibility of need for workload adjustments, team teaching, and faculty learning communities can be a part of the system to include adoption in continuous improvement systems and also garnering input and continuous support. As Sanjay in his systems theory emphasized, people support what they help create. So we need to make sure that we have faculty engaged early, they have an understanding in the process, and they're engaged in the process from the beginning. Likewise, it's equally important to make sure that students are involved in the process early. Student voice is really vital to competency-based education. Learners experience the model firsthand, so their insights are really key to helping us improve the pacing, the clarity, and fairness of integrating this model. We need to engage them when pilots are done, collecting of surveys, getting their feedback in focus groups to really gather real-time feedback from them, especially in the course design and in grading systems. Help students become really active participants in this process by training them to interpret rubrics, engaging them in systems where we have them invited to meetings to discuss these processes and provide their input. Give them a seat at the table in terms of giving feedback, providing their feedback once a pilot might be used and how that looks and feels for them, and make sure that we're responsive to any needs that they indicate might be requested in this process or student needs that are indicated in meetings. And it's important to make sure that learning analytics can be personalized through academic advising, making sure students have support through the process, and that they stay on track and meeting their learning needs. The role of academic leadership is really key to this process as well. Leadership derives the success of any systematic change. Leaders must make sure that they're setting a vision and aligning this with the institution's mission and accreditation requirements. This is a key to making sure that this vision is communicated clearly to all the key stakeholders previously mentioned that are involved. Excuse me. Because competency-based education represents a culture shift from first-time credit hours to more measurable learning outcomes, leaders must champion this change and the model and the collaborative behaviors that are required that they want to see. Additionally important is championing the financial resources that are essential to taking on a process like this. Support from leaders includes release time for redesign, for professional development of faculty, and upgrades to assessment systems and any associated costs that might be involved with that. Leaders must also oversee policy reform within the institution and program, ensuring that competency-based education is embedded into grading policies, government documents, and all associated decision-making. Cross-departmental collaboration can't be really left out there to chance. We need our leaders to enforce, to create structures, and involve themselves in committees whereby this work and accountability and ongoing feedback and surrounding systems with all the key stakeholders are involved and are overseen by our leaders. So what does this look like? Shared governance is a model that takes into account shared decision-making, which is required for this type of system. It ensures that everyone has a voice in program redesign. A steering committee should include members from all functional areas to make sure that we have faculty, administration, students, assessment teams, and most importantly, IT representatives who can really make this real. Transparency is really essential in these shared decision-making parts and strategies. We need to make sure transparency is upfront in publishing any meeting notes, defining how decisions are made, and tracking action items and who's responsible for those. We need to make sure a consistent meeting cadence is set up, which includes quarterly decision-making meetings where revisions can be made if need be, if the plan is not proceeding as planned. Formal governance adoption is really important to integrating this system and staying on track. Updating committee changes, charges, and academic policy manuals related to this, the review process, and outcomes attainment all need to be part of these decision-making steps involving all key stakeholders. So we talked a little bit about curriculum alignment to the AACN essentials. And I wanted to just share very briefly how we map these essentials and what this looks like. So I'm going to show you some examples in our following slides of what some of these mapping systems look like. But in these maps, each course is going to be mapped to one or more of 10 competencies, or in the essentials as described as domains. We're going to define where the competencies are introduced, reinforced, and assessed. We're going to use the maps to check for overlap or gaps in our program or courses. We're going to align our learning activities and assessments with sub-competencies, which are also identified in the AACN essentials. And then we're going to validate these maps through external review or advisory input. This is an example of what the steps look like in terms of mapping, and it guides anyone, any program could use this as a guide to look at their program outcomes, their course outcomes, their current courses, and actually go through the steps of mapping. So you can see we're identifying program outcomes, we're identifying end of course outcomes. We're then going on to create course maps, define the course assessment strategies, looking at our stakeholders and their analysis of those maps, identifying any gaps that we might see along the way, looking at instructional activities that are associated with our courses, evaluating our course maps and our assessments and our teaching strategies, and looking at all those collectively. And are we identifying gaps? Are we seeing overlaps and correcting those? So I'm going to show you some examples of our AACN essentials and what this looks like. So you can see on the far left column here, there are the actual domains that are identified in the AACN 21 essentials. And you can see domain 1 through 5 on the screen. Next is the competency level. So this is a stated competency based on the AACN essentials, and that's what we're looking at. So the next column, we look at these competencies within the domains, and we begin to look at the sub-competencies involved. What do our learners need to do and accomplish? How can they get that done? There are examples of ways that we can structure our assessments and types of assessments that we can do, and where this particular course or assessment aligns in our program, and how does it align with the progress we want our students to make as they're moving from a level 1 competency to a more advanced competency and mastery as they proceed with the program. Another example of what this looks like in mapping, and this looks very much like what Dr. Morse and I have been working on in mapping our current Rn-bsn program. We're looking at the competency, which is identified in the left column here. Here's the name of the competency. There are several sub-competencies that Aacn Essentials have identified, and those are listed here by name. So then for each particular course that we're looking at, we're using the domains, the course objectives, and whether we're introducing this particular competency, sub-competency, whether we're reinforcing it or whether we're demonstrating it. So we're doing this as we move throughout the curriculum for each course. Then we're putting in within our particular map the type of evaluation that we're doing. Is it a quiz? Is it a presentation that we're asking students to do? Is it a simulation? Is it a case study? And then we're taking it a step further and we're identifying what progress indicators, what student mastery would actually look like at the end, or what progress indicators as they're developing in their knowledge along the way to achieving mastery. So here's another example of the type of mapping system that can be used. And this certainly could be adapted for any type of program. So technology, as I've mentioned, is really key for integration of a competency-based model system and delivery. So we need to make sure we all use Canvas here at UAGC. We need to make sure that we have current learning management systems that offer support to this learning model and pacing of students as they progress from course to course, making their assessments reflected in the rubric key indicators that they are to demonstrate along the way as they progress from course to course and where they achieve mastery. And that needs to be clearly demonstrated within our tools that we should have available to track this in our Canvas system. We have to make sure that technology is used to implement dashboards for real-time progress tracking so that faculty can see and view, as well as program managers, student progression. We need to make sure we have technology systems in place to use and track e-portfolios so that we can effectively demonstrate those competency achievements. We need to make sure we can ensure that the integration of our assessments and rubrics and our feedback tools are visual. We can see indicators, and we need to make sure that we have systems in place through IT to provide training for faculty and students to use on the tech platform that will need to be integrated into any learning system model used for this process. So really our key indicators here are feedback systems. We need to make sure that we have clear communication, we have goals, strategies, we have teams in place to look at all of this collectively. We need to guide and plan, adapt, revise, and this communication is equally important and effective to make sure that the communication flows, systems are adapted as needed. We have clear structured panels where we can gain input from advisory boards, from students, our key stakeholders. We can communicate effectively our decisions, and we use these essential feedback loops as is required by Sanjay in systems use and refinement. Some of the barriers that as with any new change in implementation, there are several potential barriers that we need to consider: faculty workload, as mentioned, and time constraints, gaps in our IT systems, resistance to a shift from a traditional teaching model to this competency-based model, inconsistent feedback and systems across departments, and unclear rubric expectations and assessment systems can all be barriers to successful implementation. So what do we do about this? Well, we can overcome these barriers by using systems thinking. We need to use our feedback loops to make sure to surface and solve system-related issues, align incentives with institutional goals, such as giving faculty that needed release time to engage in this process, offer more professional development that might need to be made according to the roles key stakeholders play in these systems, make sure we reiterate and consider our shared vision and clear communication within and among all our key stakeholders, and make sure we build momentum in this process and share and celebrate small wins and pilot our success stories for implementation. So our implementation plan really it has started back in 2024 with engaging in initial discussions about this, but then we've mapped this according to a system thinking model across a 3-year implementation plan. So you can see in 2025, we talk about shareholder engagement. We've started doing some curricular mapping. In quarter 3 and 4, we're going to engage in more of the faculty training. We've already shared with faculty our work so far in faculty meetings in this system, look at potentially policy updates, and maybe perhaps put together a pilot course to see what that might look and feel like prior to moving this forward along the trajectory for a full launch. Going into 26, we're going to look at pilot data, look at evaluations. We might need to do some revisions in quarter 3 and 4, expand more courses in this competency-based model, look at our tools, and make necessary revisions as a part of an iterative process where we continuously revise, assess, reevaluate, and adapt. In quarters 1 through 4 of 2027, we'll look at all the structures in place to implement a fully operational model. So that's an initial strategic plan and what that might look like. Throughout this process, we need to make sure that we're looking at our data dashboards that will be set up for us to set up and track our identified student competency achievement. We'll need to make sure there's consistency in our rubric, how faculty are using those rubrics to grade. We'll need to make sure that we look at student satisfaction and making sure there are trends that we identify for how well students are able to achieve those progress indicators and mastery of the outcomes. We'll need to make sure that we're looking at evaluation systems and review cycles and adapting as needed and informing our key stakeholders of this iterative process and making continuous improvements based on the data that we see. So the shift then to competency-based innovation will embed all of our processes just mentioned, starting with faculty training, onboarding, policy development, developing strategic plans, providing ongoing training and peer mentorship to get through this process, creating long-term competency-based education governance models, stopping and rewarding innovation and recognizing our faculty for their contributions, and making sure that we maintain an alignment with the essentials and our workforce needs. So other universities that have started this process before us engaged in similar systems that we've identified here. And they've identified with starting early, gaining feedback from key stakeholders, the focus and need for ongoing communication, and that we don't skip our faculty and helping them move along in the process, making sure that we give them ample time to stay engaged, give feedback, and to make sure that we also have the support systems in place to make sure that this all collectively comes together, and we adapt and make changes as needed as we progress in the process. So our final call to action: competency-based education fosters equity, mastery, and relevance in any program above and beyond the RN to BSN education model. We need to focus and strive for stakeholder collaboration to make sure that the system drives quality and sustainability. Systems thinking really can be used in any program to ensure alignment across key stakeholder roles, functions, and using these key stakeholders across departments internally, and also engaging our external advisory committees and our employers to make sure that our curriculum remains current in our healthcare industry. We need to make sure that we begin mapping the curriculum, defining our vision, staying engaged in building the momentum, and working as a group collectively to transform this change. Now, I'll ask if you have any particular questions. I know that was a lot of information. Sally, if you have anything that you've seen in the chat that I can address, or
I, yeah, I haven't seen anything, but please, if some questions crop up after this, I'm sure Dr. Beck would be happy to receive them. We are at time, and with the edited version, I don't want to uh, chop anything off.
well,
And
thank you all
I
for engaging in the presentation. Yeah, I believe all of you have my email contact information, debbie.beck@uagc.edu. If you have any questions based on what you heard today, thank you so much for
Thank you very
participating.
much. Yes, and again, Stephanie behind the scenes there dropped the link in the chat for our um review. And so I will thank you very much, Dr. Beck, for your presentation. So much good information, generalized, can be generalized across the curriculum. And thank you all for your participation, and enjoy the rest of your TLC.